I'm talking to Leanne Kaye. Leanne is a UK-trained midwife, CEO and co-founder of Pregnant in the City and Night Nanny International. Hi, Leanne.
Hi. Good morning.
Leanne, the first thing I'd like to ask you is, what is a midwife and what are the benefits of having a midwife?
Okay, so a midwife is an autonomous practitioner who deals with the normal, from pregnancy through to delivering the baby, and the sphere of practice is the first 28 days of the baby being born. Autonomous means that midwives can make decisions and carry out care without requesting permission from a doctor, which is very different to a nurse. In a lot of places in the world, there are still obstetric nurses. So it's important to differentiate between a midwife and an obstetric nurse, is that the midwife makes decisions and is responsible for her own sphere of practice.
What is the benefit of having a midwife?
I think the benefits are widespread, and what women would say is having a midwife is having somebody to really be that support role on a psychological level as well as on a physiological level. And when you're entering birth and it's a normal birth, often a lot of doctors will say that's their specialism. There's phenomenal midwives out there in the world practicing today. 25 years, they've seen it all 15 times over, and they're there to provide this care for you within and recognise the abnormal. So the idea is that they stay in their sphere and they deal with everything that's normal that's going on with you during pregnancy and during the birth process and the labour process and up to the first 28 days. If there's ever a sign or an indication that things are going beyond the realms of normal, that there's any need, then it's our job to call in the doctor.
Today we're going to focus on water births. What is a water birth, and is the water birth safe?
A water birth is when the baby is delivered into water and the woman is in a birthing pool. There are many different versions of the birthing pool all over the world. The main idea is that it's quite big and comfortable for the woman to feel much bigger than a regular bath. The idea is that that's very northern of me, bath. The idea is that the woman is submerged and can really feel that weightlessness of being in the water. And a water birth is when the baby is literally delivered, is born into the water, and then brought onto the woman's chest. Very different to labouring in water, which does also exist all over the world, where the women will be taken out of the bath for delivery.
What would you say are the benefits and negatives, if there are any, of a water birth?
So there are a lot of benefits, and both psychological and physiological and biological, what actually goes on inside a woman's body. So the benefits are that women often feel much more secure and confident to birth into labour in water, not just because of an analgesic, not just because it relieves pain. It actually gives some women just get this sense of safeness and security and feel just so much more relaxed. It has an actual impact, and they've noticed now that actually releases oxytocin, the birth hormones, the necessary hormones to give birth, are higher when women are in water, and it's all to do with this playing of keeping a woman relaxed and feeling in control and comfortable. The other benefit on a both emotional and a physiological level is that it actually can reduce incidence of tears, and any problems when the baby's born are often reduced because of the actual effect locally on the skin of the water. Sorry. Talking of water, and it actually has a known effect to reduce blood pressure, as well as and by reducing the blood pressure, what's going on, what's the whole picture of the woman, is that she's in a lot less stress state. She's relaxed, and therefore can really have a great benefit of the birth. One of the negative things about water birth is that if you get in too early, you can over-relax the body, and therefore stop the labour progressing. So there's a really definite window of recommendation of when to get into the water. And that is normally once you're in active labour. They don't recommend you get into the pool before 3-4 centimetres, ideally even after 5 centimetres dilated.
Is it possible for women who might be a bit worried to have a water birth at a hospital?
Yes, definitely. Around the world now, there are birthing centres where it's very, very safe to give birth in water, and you're there. And my second son was born in a water birth in a birth centre, which was part of a hospital. So we're sort of on one floor, and they've got these purpose-built birthing pools. And then if anything goes wrong, it's quick and easy to get the medical help that you need.
What keeps the baby from breathing underwater?
No, that's a great question, Tim. So when the baby's born into the water, there's actually a physiological mechanism. The larynx will not open, will not accept water. It'll only ready itself to breathe when the larynx, when it hits oxygen. So the baby will not even attempt to take a breath physiologically until the baby's out of the water.
How long is the baby left in the water?
That's also a very, very good question. The baby is not so much left in the water. The idea is that the baby's born, and the midwives are trained in the room. So once the baby's head's delivered, you've got a certain amount of time, as is the same, out of water as in water. And the baby's literally, as the baby's delivered and totally expelled from the uterus, totally born, then the baby's just literally straight away taken up and put onto the baby. Put onto the mother's chest.
How is the baby monitored during the water birth?
So as with regular birth, the baby's intermittently monitored, as is the mother. The mother's also monitored for temperature to make sure that she's not getting too hot or too cold. And the temperature of the water, has to be maintained. In order that when the baby's born, it's at the perfect temperature. So the baby's heart rate is listened into intermittently with a waterproof sonic aid. So a sonic aid is a piece of equipment that listens through the woman's abdomen so you can hear the baby's heart rate.
What would be, just briefly, the general procedure of a water birth? So the idea being that you don't go into the water until you're 4 to 5 centimetres, so you're well established in labour. And you're in the water, you can get in and out of the water as and when if you'd like to. Most women tend to, from around 6 centimetres, 7 centimetres, they're going to stay in, and that's okay too. And the general procedure is that you're in the water and everything's checked on a regular basis, your temperature, your blood pressure, the baby's heart rate. The midwives are ascertaining that the contractions are coming. Sorry. And then there'll be at least 2 midwives in the room when the baby's born, and they will ascertain that your baby's ready to be delivered. Some very experienced midwives will not even do a vaginal examination, so they won't necessarily feel they have to confirm that you're fully dilated. They'll kind of go with the flow and then assess the woman's behaviour. But generally they'll do a vaginal assessment to check that you're fully dilated and ready to push, and then they'll encourage you to push, and you'll push your baby out in the water. Thank you, Leanne. Thank you so much for talking to me today.
Thank you.